Hi there, this is Michelle from Therapy Works Together. I'm the speech therapist and clinical director, and I wanted to talk to you today about how I structure a parent coaching session for children that are toddlers, that are young, and are obviously not going to be sitting in front of the screen and doing the Zoom session with me or one of the other therapists. So, how do we structure it? What are the things that I ask? What are the things that I look for? So there are basically six questions that or six items that I go through to kind of structure the session and see how things are going. So let me take you through the six parts or six questions. So the first one is, how are things going? Right? That gives the parent the opportunity to tell me how things are going, why they're here, why they've contacted us for speech therapy, how we can help. What are the things that they're noticing in their child that have brought them to speech therapy today? That gets a conversation going. That gets us talking about what their thoughts are about where the child is right now, where they think the child should be. We talk about milestones. We talk about, are they making comparisons to things that are developmentally appropriate or not? What are the things that are going on that prompted them to come and get help today? So that's number one. Number two is, let's just hang out. So that's something that's a little bit sometimes scary for parents because they don't know what I'm looking for or what one of the therapists is looking for. They don't know if they're going to be judged, if there are going to be any sort of expectations. What are we looking for? What am I observing? But it's a time that I'd really like for them to just relax and hang out with their child. Maybe they've put some toys on the floor or on the table, or they've brought their child, in the high chair to the table for a snack or whatever it is. But let's just hang out. Let's just observe. There's no expectations. Just do what you normally do with your child. And me as the speech therapist, I'm just observing to see what is going on. After that, I do a little bit of a review and I ask them, did you see your child doing X, fill in the blank. So sometimes I'm observing the child making communication attempts or doing things that the parent doesn't even realize that they're supposed to be paying attention to. So sometimes it's making eye contact, sometimes it's making a vocalization or a gesture that a parent doesn't even notice might be a communication attempt on the child, and it's something that we can actually capitalize on and use to our advantage or build on during the session or during subsequent sessions. So just pointing out to the parent what I've already observed in that let's hang out period is something that's very important. So did you see your child vocalize, for example? The next thing, this is number 4 that I'm going to talk about right now. The next thing I ask is, what might happen if? So this is where I kind of, and by if, what comes in after that is, try this speech therapy strategy that works even if I'm working with your child face to face. So what might happen if you give your child 2 choices, for example? So if the child is not requesting, for example, what would happen if, or what might happen if you gave your child 2 choices, and now instead of just getting that apple or that block or that car, that toy car that they're playing with automatically, because you as the parent already know what they're anticipating and what they might want, what might happen if you held that toy car back? What might happen if you gave them the option of the toy car and the block? Then the child is actually prompted or cued to make a choice and do something to get the actual object that they want. So the child might reach for the car, the child might vocalize, the child might point. We're trying to elicit a little bit more communication, right, from the child at that point. But that's the point where I ask the parent, what might happen if you try this? Okay, number 5. After we've gone through the session, I ask, how did it go for you? So this is an opportunity for the parent to reflect back and think about what went well, what might not have gone well, what they observed, what they thought about what I've observed and noted, what they think about the strategy that I might have shown them. How did their child respond? Is this typical for the child? Is this something new? How did it go for you? How did it feel? Did it all of a sudden feel like, wow, I never thought that just giving my child two choices might get them to communicate at a slightly higher level than they already do? So how did it go for you? Okay, and number 6, the last thing that I ask them is, what's one thing you're going to take and do over, for example, the next week or until the next time we meet? So that gives the parent an opportunity to think about what are the strategies or the things that we tried during the session that they think perhaps worked. Just pick one thing, actually. What's one thing you're going to take and use in the next few days and kind of sprinkle throughout your day and throughout the everyday tasks that you do with your child? So that's something that's very important, is how are you going to integrate this one thing into your day? We're not expecting you to restructure your whole day, or, all day now has to be this one elongated speech therapy session. Absolutely not. That would be too disruptive. We actually want you to integrate the strategies that do work for you and your child into everyday activities. Bath time, getting ready for bed, meal times, getting ready for school, whatever it is. How are you going to integrate that? So what's one thing you're going to take and use throughout your day in everyday activities? That gets the parent thinking about what they're going to integrate between now and the next time we're going to meet. And that's really an important structure for speech therapy sessions that happen online, that are more the parent coaching model, where instead of the speech therapist coming in and really automatically using the strategies that we know work, instead what we're doing is really empowering the parent to do or to use the strategies that we know oftentimes work into their day. They're the child's best teacher, so integrating that into their day and becoming their child's speech therapist. That's a very big priority. So that's actually a benefit of parent coaching, is I'm supporting parents to be their child's teacher and to really empower them to make the changes in their child's communication skills. So those are the 6 things. Thanks for listening.